Hello friends, welcome to a new lecture. 59-year-old man with chronic knee pain worsened by increasing walking and bending now has new pain with localized swelling behind the knee. His MRI is shown in the figure. Where is this lesion located? So the lesion is mainly located here. This is the fluid collection, and here this is located behind the medial condyle, and this is called as popliteal cyst or Baker's cyst. Then this lesion is a fluid collection that extends between semitendinosus and gastrocnemius tendons into the potential bursal space. What caused this lesion? This is mainly caused by the arthritis. What are the cell counts and protein content in the fluid? This is a transudate, so obviously the protein content will be very low and few inflammatory cells are present. Thank you for watching.